here are the 5 categories of the 5 shoe points. We'll start with the Jing well. The Jing wells are always on the fingertips or the toes, or close to them, and they are used predominantly for loss of consciousness. Predominantly loss of consciousness. Pericardium 9 is literally at the tip of the middle finger. This is the #1 point used for loss of consciousness, besides DO26 that you referred to on the face. Benson, you had asked before we started class about lung 11, which is on the thumb, right here, on the radial side of the thumb. And you were wondering why it helps return the voice and
Correct.
get rid of heat you were
Correct.
talking about?
Correct.
Yeah? Okay. So Jing well points, you can also do something else. You can bleed them. And whenever you bleed anything, you're clearing that channel. You're also clearing heat from that channel. Bleeding clears heat. It's wonderful. It works really well.
Can you clear moisture as well, or you can't? It's
No,
more
I've never
like
heard
heat.
of using this for moisture.
Okay.
And so if someone, for instance, has a wind heat or has lung heat, then you clear that heat out and then their voice can start coming back because there's not too much heat drying out the fluids.
How much clearing? It doesn't really matter, right? What I heard is 1 drop is good enough.
What I do is I bleed it and then I keep swiping it until it stops bleeding it with a cotton ball. You know, like 1 comes out, okay, 2, 3.
So the text never mentioned like how much, or
yeah, you don't want to overdo it because blood is considered so vitally important. And usually, at most, I'll get like 4 or 5.
Okay.
Unless I'm purposefully trying to get a lot of blood, which when I'm doing that, it's only when I'm treating pain.
By the way, that technique works like magic.
Yeah, so good.
Unbelievable.
So good, right? Yeah, so good. Love it. The other thing you can do this because it's so pulling out of stuck energy is you can use it for pain on the channel. Okay. However, it's very, very sensitive, these points. So most patients don't like it. I do have one patient he's like this great guy who's like very intense, and he loves these points. He's like, okay, let's do it. We're gonna do it. Let's do it. Loves it, and it works. It's out of all of the things that I've done for him, it works the best. But you can't do that with everybody.